Thank you, Rebecca, and warm welcome to all of you to this IC. And so my topic is on the genesis of myopia progression, because we need to understand how myopia progresses in order to understand the strategies that can be used to prevent myopia progression. So these days you come across a lot of new modalities in the prevention of myopia progression. For you have to know why it is progressing in order to know at which point do these modalities work. So there's always been a argument whether it's the inherent nature of a child that leads to myopia or whether it is his environment that leads to myopia. So it's always nature versus nurture. Nature is what the genes that you are born with, and nurture is the surroundings that you live in. So you would have seen that in developed countries and where in developed economies where people are getting more and more educated, uh, and people are moving towards the cities. In those areas, the incidence and progression of myopia is more. So there has to be something to do with the environment in which a child is brought up also, that is also contributing. Now, genetic definitely has a role to play, and there is no single gene which can be blamed for myopia progression. In fact, there are several genes, almost 100 genes, which are shown in children who are progressing with myopia. Uh, if your parent has a myopia, if one parent has a myopia, then 10% risk of myopia in the child, and if both parents have, then the risk is up to around 40%. There are more than 100 candidate genes for myopia progression, but these are running in families. We are more worried about why school myopia happens or why a normal person with no family history becomes myopic. So for that, you need to understand how the eyeball grows. So when you're born, when a child is born, he is not having perfect eyesight. So he's not 6/6, he's not emmetrope. He can range from very high myope to very high hyperope. When they are born and then they open their eyes are getting stimulus from all around, and that is pushing their eyes towards emmetropia. This process is called emmetropization. So here in this graph, you can see on the left side, you see the refractive error spread across the spectrum in a newborn, and as the child becomes 6 years old, they tend to bunch around emmetropia. So how does this process happen? In order to understand that, people did an experiment in animals, and several animals, we owe the signs to these animals, which can be chicks, shrews, and monkeys, wherein they use two strategies. One is form deprivation myopia, and one is lens-induced myopia. Form deprivation myopia is where you shut the eye of the animal after they are born and see how the eyeball grows without any external stimulus. And lens induced myopia is where you either put a negative lens or a positive lens in front of the eye and see how the eyeball responds. So the first concept is hyperopic defocus. You must be hearing about this a lot since the myopia control lenses have come. What is hyperopic defocus? If you stimulate these animal eyes with a positive lens, then you are creating a hyperopic defocus. And a negative lens, a minus lens, then you are creating a hyperopic defocus, because the rays will be focused behind the retina, and that will lead to elongation of the eyeball in order to accommodate those rays. So if suppose this is the back side of the retina, and the rays, you are, by using a concave lens, you are putting the rays behind the retina, then the retina is going to try and seek the image, and it will cause elongation of the eyeball. So when the rays are focused behind the retina, it is a hyperopia. No? So when you have a hyperopic defocus, the elongation will happen and the axial length will increase. Now this effect is also seen if you cut the optic nerve of the animal. Suppose you cut the optic nerve of the animal and still stimulate it with a concave lens, still the eyeball grows. So that means it is not the visual pathway which is dictating that, it is something which is happening very locally. The same thing happens if you put a myopic defocus. So if you use a plus lens in order to focus the rays in front of the retina, then the eyeball elongation stops actually. So this has also been demonstrated. And recovery. So once you remove that stimulus in these infant animals, the eyeball again tends to move towards the image. So that means it tries to stop the elongation of the eyeball. So recovery is possible. So here the stimulus causes the increase, and if you remove the stimulus, it arrests the increase also. So this shows that by stimulating the retina in a particular way, you can increase or decrease the myopia. Okay. Now, if the lens is optically corrected, so suppose if you induced myopia in an animal by putting a concave lens, and then later on you corrected the myopia, then this myopia will stay. It will not go away, because now the image is formed on the retina, and so there is no stimulus for it to get corrected. So in these infant eyes, when you remove the stimulus, again there will be recovery. So this is the arc which has been proposed. So there is a defocus on the retina which leads to a retinal response. So the retina is not getting a clear image, so it sends signal to the sclera in order to grow. So when the sclera grows, the retina goes back with it, and then the image is focused on the retina. Same thing happens when you are trying to do some near activity and you are not able to focus because of an accommodation problem. That will also cause the eyeball to elongate. That's why you see the studious people in the class will get glasses, because they are doing a lot of near activity. Near activity requires accommodation. Now, if there is a difference between the amount of accommodation required and the accommodation that he can do, that will lead to elongation of the eyeball in order to accommodate that image. So these are the two ways in which the eyeball can grow. So the question comes then, suppose somebody has got myopia and you have given him a minus lens and he is corrected now. So there is no stimulus for the eyeball to grow, right? He is corrected. So neither should it become more myopic nor should it become less myopic. But you would have seen that everybody starts with 0.5, 0.75, and then you give those glasses. Next year they require more. So why does this happen? You've already corrected and the stimulus is not there. So to see what happens, this Earl Smith did experiments in the late 90s, and what he did, he ablated the fovea of the monkey, okay, and then stimulated the periphery with a concave lens. And he saw that in spite of the fovea not being there, so now you don't have the optic nerve, you don't have the fovea, still the eyeball elongates. Okay, so when you are correcting the eye with minus lenses, probably it's only the fovea which is getting corrected, but in the periphery it is still hyperopic defocus, so that is causing the elongation. This was again proven by stimulating only a part or a section of the retina. So if you put a hyperopic lens just to stimulate a small portion of the retina, then only that part of the sclera bulges out. So as you can see in this MRI image, where only a part of the retina is stimulated with a hyperopic lens, only that part of the sclera is bulging. Okay, so this is a very local communication that happens between the retina and the sclera. So where the image is not clear, the sclera will tell the retina will tell the sclera to grow, and that way the eyeball will elongate. So what happens in spectacle wear, where you are using your normal spectacles, you are putting a lens which is focusing the image on the sclera, but it may not be focused in the periphery. So it's the sum total of defocus. So at one point there is no defocus, remaining part there is hyperopic defocus. So the sum total is hyperopic defocus, that is enough to cause the elongation of the eyeball. So somebody might say, then don't correct myopia. Let it, little bit of myopia, leave it. Like olden times people used to leave around 0.5 myopia, because then all the time there will be myopic defocus and you require a hyperopic defocus for the eyeball to grow. So if you leave the child myopic little bit, then it will not grow, logically correct. But what happens if even if you leave him 0.5 under corrected, still in the periphery, because of the oblate shape of the retina, it is hyperopic only. And you can't leave him -1 or -1.5 under corrected. Probably that would be a good strategy, but then he won't be able to see properly. So the entire purpose is defeated. So that's why it doesn't work. And in other, so you must have heard that progressive bifocals work. I think somebody will cover it later. They also help by stimulating the periphery of the retina. So now this is what happens with the general stimulus which is coming from infinite. So now what happens when you are doing near work? So you would have seen that near work, education, affluence and urbanization all contribute to the progression of myopia. So what is that happens in near work that is not there in distance work? So it is accommodation. So you are accommodating when you are doing near work. So maybe there is some problem with the accommodation. That is where the theory of lag of accommodation comes. So suppose you want to see at a distance of 30 centimeters, 33 centimeters. Now you require an accommodation of +3, suppose. And if your eye is going to provide only +2 accommodation, that 1 diopter is the accommodation lag. Then you might say, then why is he still able to focus? There is an accommodation lag, then how is still focusing? That is because of depth of focus. So the moment you see near, there is pupil constriction. When the pupil is constricted, the depth of focus increases. So in spite of the image not being in clear focus, you are able to see or read. So accommodation lag is also thought to be one of the causes of progression of myopia, where the amount of accommodation that is supplied by the eye is not enough, not equal to the demand that is laid on the eye. That's why they say in bright light you should read. Why you should read in bright light? Because when you are reading in bright light, your pupil constricts. When your pupil constricts, your depth of focus increases. So when your depth of focus increases, you have to accommodate less. So when you have to accommodate less, there is, less stimulus for myopia. That's why reading in dim light is not suggested. Uh, I think the remaining topics will be covered by them. Thank you very much.
Thank you, sir. I think you have beautifully covered, the etiopathogenesis, which is quite the most controversial part in myopia, beautifully and in detail. So, because based on this etiopathogenesis and the risk factors, you will then devise your management options. So, now directly coming on to the management options in myopia. So, the most common and the most accepted intervention that we know is the pharmacological